Healthy People 2020 and Communicable Diseases, Botulism, Pertussis, and Mumps. Introduction. The Healthy People 2020 initiative has the aim of improving the health of Americans by providing national health objectives and benchmarks. This initiative also aims to improve the health of the population through input from different sectors. The objectives, goals, and indicators in the Healthy People 2020 initiative work towards improving the health of the population. The city of Miami, Florida has available surveillance data on communicable diseases. This essay analyzes botulism, pertussis, and mumps as the three population-based communicable illnesses. Objectives, goals, and indicators. The goals of Healthy People 2020 include improved health and quality of life for the population. In addition, the initiative aims to achieve health equity and reduce the existing health disparities. Additionally, the initiative aimed to promote the creation of social and physical environments promoting health for all individuals. The other goal of this initiative is the promotion of improved quality of life, healthy behaviors, and development. There are different indicators in the Healthy People Initiative 2020. These are measured to evaluate the effectiveness of the program and the changes that are anticipated. Besides, the indicators are categorized into groups such as leading health indicators. The main leading health indicators include access to health services, clinical preventive services, environmental quality, injury and violence, mental health, reproductive and sexual health, and maternal, infant, and child health. Epidemiological and surveillance data. The state of Florida has adequate epidemiological data on communicable diseases in the population. This data is useful for the city of Miami, which is the city under discussion. The available epidemiological data covers diseases such as botulism, pertussis, tuberculosis, mumps, HIV/AIDS, malaria, Lyme disease, rabies, syphilis, varicella, meningitis, and other conditions. However, this analysis considers epidemiological data on the conditions under discussion. Botulism. The available epidemiological and surveillance data for botulism occurs in different categories depending on the mode of spread of the condition. The categories include foodborne botulism, infant botulism, and wound botulism. There were few reports of botulism in Miami and the state of Florida. Only one case of foodborne botulism was reported in Florida between 2003 and 2013. On the other hand, there were 8 reported cases of infant botulism reported over the same period. The rest of the cases were in the last category. Pertussis. Pertussis is a reportable disease in Florida, and medical practitioners are required to inform the authorities if a patient has this disease. The prevalence of pertussis in Florida is higher than that of botulism. The number of cases reported in the year 2012 was 575, representing an incidence rate of 3 per 100,000. This figure represented an increase of 70.6%. The available epidemiological data also focuses on race, age, and other demographic groups. The prevalence of pertussis increased over the last 5 years, with the disease causing the death of more than 20 people over the same period in Florida. Mumps. The other condition analyzed is mumps. This disease results from an infection with the mumps virus. The disease causes the death of 10 to 20 people annually in Florida. In addition, this disease mainly occurs in individuals who are not native to the state or have traveled to other parts of the world such as India. The disease causes significant morbidity in affected individuals and results in the death of some of the victims. In addition, the disease is expensive to treat. However, there are available countermeasures that are effective in the control of mumps. Effect on community and plan of action. This section discusses the effects that the 3 communicable diseases have on the Miami community, their identification, and the plan of action based on the Healthy People 2020 initiative. The 3 diseases affect the general health of the population and put healthy individuals at risk of infection. In addition, these conditions have high mortality and morbidity rates. The diseases are expensive to treat, and the complications require ample financial resources. Conversely, the other effect that botulism, pertussis, and mumps have on the Miami population is economic. Aside from these effects, the three diseases lead to disabilities in individuals who do not get adequate management. The identification of pertussis, mumps, and botulism in Miami takes place through a structured program. Patients suspected of having the disease are required to report to the nearest health facility. The different signs and symptoms of this condition are reported to the healthcare providers to do tests to establish the presence of the disease. After confirmatory history, examination, and investigation, the care providers report the positive patients to the local health authorities for epidemiological recording. The patients also receive care for their diseases. The Healthy People 2020 initiative has important guides on the identification and containment of diseases such as mumps, pertussis, and botulism. The first of these is the determination of the capacity of health institutions in Miami to detect and manage the cases of these conditions. In this objective of the HPI 2020, the facilities receive adequate equipment and personnel to assist in the detection, management, and surveillance of these conditions. The second part of the initiative is to ensure improved environmental conditions to reduce the spread of these illnesses. Healthcare workers have the responsibility of ensuring that patients with communicable diseases get the best care to improve their condition and ensure that they do not develop complications. Environmental improvement entails eliminating the conditions that facilitate the spread of diseases. In addition, the government carries out immunization programs to reduce the incidence of these illnesses. Social determinants are important to monitor in the prevention of the three conditions. Additionally, the three diseases may be prevented through community health programs and health education. The population needs to be prepared to manage illness and report to health facilities early. Early detection leads to a reduction in prevalence. The other intervention that is necessary to reduce the prevalence of the three conditions is the improvement of living standards for the population. An improvement in these conditions contributes to the reduction of the prevalence of these conditions. Conclusion. In conclusion, the Healthy People 2020 initiative is an important policy in the prevention of diseases and their management. The three diseases that are analyzed in the paper include pertussis, mumps, and botulism in Miami, Florida. The existing measures in this city are insufficient to prevent the spread of the conditions. The Healthy People 2020 initiative provides an effective method of preventing the development of these conditions.